everybody. I'm Joanne Haigh, and welcome to Face It and Fix It on CBC TV 8, YouTube, and of course, Facebook. I hope you guys will have a wonderful weekend, a packed weekend. I had last weekend, and I'm hoping to take it easy this weekend. But I hope you guys had a wonderful weekend last week. I wasn't here on Friday, unfortunately. I had to deal with some personal issues, but I'm glad to be back. So what's on my mind today? The Queen Elizabeth Hospital is on my mind today. And I know right now, given the information I have from some people that messaged me over the last couple of days, the hospital has been having some challenges. And of course, we have on more than one occasion extended an invitation to them, and I know that they will make it here to this show sooner rather than later to discuss some of the issues. But in the meantime, there are some things that stand out in my mind, and that is the accident and emergency department and the waiting time. The Queen Elizabeth Hospital will tell you, and this is a fact, it is not a first come, first serve basis, and I think the public understands that somewhat. But I think some of the challenges go more towards the assessment phase. And the question is, how can you determine who gets in first if the assessment is not done? That was a question I had earlier this week from someone. Unfortunately, a family member was there, and they said that they were waiting for an assessment for a good few hours, and they see other people coming in. So I'm not quite sure how that works. I would think that everybody has to be assessed, and then the determination would be made as to who gets through the door first. But on another note, the challenge is there for the nurses and the doctors. They must be under tremendous pressure, and we need to be a little bit more patient, I guess, with them. But when you are not well and someone tells you that, it's kind of hard to swallow, especially for family members who are urgently awaiting a response from a doctor or nurse or a patient advocate. So that has been on my mind. Of course, my mom herself was not well, patient at QEH. I believe she was now discharged this morning as I speak. I just got that information in. So I want to thank the staff at the QEH. But I also want to mention to the public, please take care of yourselves as much as you can. Avoid the Queen Elizabeth Hospital. Avoid polyclinics by simply trying to eat better, trying to look after yourself better. I know I don't practice what I preach sometimes in this regard. I am working on it. Healthcare is something, I've said this before and I'll say it again, it is something that I have to face and I have to fix. I don't rush to the doctor. If it's not broken, I don't believe in going to a doctor if I'm feeling good. But that doesn't mean that you're 100%. And that leads me into the news at the Queen Elizabeth Hospital coming from the Director of Nursing. News coming out of the hospital is that the cases of cancer patients, they're on the rise, NCDs on the rise. That, I believe, is a result of COVID. And when I say that, the collateral damage that COVID has caused, because so many people stayed home, and we say cancer is that silent killer, so people didn't go for their breast checks or their pap smears. And we're in a situation where some people at the Queen Elizabeth Hospital probably could have been saved with cancer, with treatment, and unfortunately, from what I understand, it may be too late for some. And that is a direct result of having to deal with this pandemic. So that's on my mind, and I know that everybody in Barbados, we are concerned about the healthcare system. We certainly love our nurses and doctors and staff at the Queen Elizabeth Hospital and right across the polyclinics. We continue to support you. But on the same hand, Barbadians are, some people are not happy with the level of service. And let's see if we can strike a balance and create some sort of win-win situation in the healthcare system. So today, as we continue to speak about healthcare, we have Dr. ADANNA Grandison, Consultant Manager of Home Quarantine. COVID is still with us. The numbers are climbing, and I believe we're about 32, 33% on a daily basis. That's a concern for many, but again, we were told that we have to live with it. And of course, remember, this is GCF Fridays, Green Climate Fund. We have Alex Harewood, project engineer, Program Development Manager Unit of the 5Cs, and he's joining us again today to talk about climate change. We had some individuals coming in, but unfortunately she's not well. JAMILLA Seeley and Reginald Burke may join us. They are from CYEN, Caribbean Youth Environment Network. So we're hoping to join at least Reginald later on, but unfortunately these things do happen. We plan, and sometimes things don't always go to plan, but we're gonna have a great show. We encourage you to call us. Today I would love to hear from you about not only climate change and the things we're talking about. Call us about the Queen Elizabeth Hospital. Tell us your experience. What has it been? Maybe some solutions you may have, you may want to share with us. Call 228-5563 or 228-5562, or send us a WhatsApp message, 228-5562. If you are watching us on social media, type in CBC Barbados, and you can leave your comments there. When we come back, Dr. ADANNA Grandison, and we are going to talk about COVID and those numbers when we come back. Welcome back to Face It and Fix It. My first guest is Dr. ADANNA Grandison, Consultant Manager of Home Quarantine. And I want to welcome her to the show again. She's no stranger to Face It and Fix It. Probably about 10 times now over the last year or so you've been here. Welcome, Dr. Grandison.
Good morning, and thank you for having me, Joyanne.
I want to say congratulations to you, first of all, on your national award. Very deserving.
Thank you very much.
I know how hard you work because I bother you from time to time when I have some COVID-related questions. So where are we now is my first question with the BA2 variant as we see the numbers high, very, very high. Is it the BA2 or is it a combination? Where are we?
So we could ourselves off to CARFA so that we can perform a very important role of surveillance. At this point in time, we do not have any additional information about the BA2 variant, but what we are seeing in community does point to the fact that we still have Omicron on the ground. We're also seeing a bit more respiratory cases, and the question to ask is if we are getting a resurgence possibly of Delta in our community, or possibly one of the newer variants like the BA2 12.1, which can involve the lower respiratory tract. And so that is why we have been very, very fervently sending off samples all the time to CARFA so that we can know exactly what we have on the ground. However, we are, as you stated, we are in the middle of essentially a spike. And you correctly stated that we are having about that 33 positivity rate, just hovering around that daily. At this point in time, within home isolation, we have 3487 persons and currently 3608 on our dashboard. So our numbers are increasing. One thing that we can state is that we are noticing lots of persons essentially being very concerned about presenting for care, and that is something that still definitely concerns us to the point where they're refusing the assessment. We do have 2 assessment centers on the island. And these 2 assessment centers are very important and critical in terms of our management of COVID-19, but also non-COVID matters in the COVID-19 patient. And as I listened, as you made your opening comments, you spoke about those very important NCDs. And we have noticed there has been an uptick in NCDs in Barbados, where we are seeing persons are not necessarily presenting to their primary care physicians or to the polyclinic for the continued management of those NCDs, for instance, hypertension, diabetes, high cholesterol. And this is becoming a problem. As you are aware, these very same NCDs are some of the risk factors for worsening COVID. And so we want to encourage persons, if you, one, know that you are afflicted by hypertension or pressure, diabetes, or what we call sugar, high sugar in Barbados, or high cholesterol, we want to encourage you to continue to follow up with your doctor. For those persons who are not sure if they may have the diagnosis, this is a time where you check in with your doctor. I know a lot of persons are of the thought process, don't fix it unless there's something broken. But of health is about ensuring wellness. So we want to ensure that you continue to stay well. So I would strongly encourage you, check your blood pressures at home, check your blood sugars at home, or pop into the doctor's office just to ensure that the machine is functioning as it's supposed to function, that everything is still good with you. And once that is the case, then you can continue as you deem fit. But we want to encourage persons really to reach out, and that is the purpose of the assessment centers that we have on the island. We have 2 of them. So if, for instance, we have any patients that may have concerns about, for instance, during their COVID period, their isolation period, their blood pressures become deranged or their blood sugars are out of whack, these are the centers that can address those issues, as well as some of the more minor COVID symptoms that one can experience. But certainly we'll have our Harrison Point facility to deal with those more major concerns associated with COVID.
So I'm hearing people talking about this particular variant. It was communicated to sound like it's more like the cold is not as bad. I guess that may be the BA-2. Now, do you think that that type of information going out there could sort of be causing this spike? Because if people are figuring, well, you know what, this is just like the common cold, no big deal. Because remember, the narrative earlier, more than a year ago, was a little bit more serious than it is now. So should we relax our efforts with this BA-2? What's the difference?
Well, BA-2 and BA-1 were noted to be a lot milder in terms of presentation, not generally affecting the lower respiratory tract. So really not seeing cases of patients feeling short of breath, or having difficulty breathing, or getting chest pain and tightness and stuff like that. However, what it has led to is persons actually confusing sometimes it with symptoms, as you correctly stated, of having a sinus drip. Okay, they may say, oh, I just think my sinuses are acting up, or I just have the sniffles, or I'm just sneezing more often at this point in time. And I have always stated it is important. That is the importance of testing. Your baseline, you're not supposed to be sneezing. You're not supposed to be having a post-nasal drip. That is something that happens when something is going on. You may not know what that something is, and in any situation like that where there is a deviation from normal baseline, we always suggest that one should get tested. But what we are also seeing in the international community is now BA4 and BA5. And those persons are actually presenting with respiratory symptoms. So again, importance of one, testing, as well as surveillance on a public health intervention that needs to be made, so that we continue to know exactly what we're dealing with here on the ground in Barbados.
So what do you mean BA4 and BA5? That's news to me. We have that here too,
so,
or we?
No. At this point in time, we have not detected BA4 or BA5. There are 2 subvariants of Omicron. So Omicron BA1 was Mummy Omicron, if you could call it that. And subsequent to that, we have had the Stealth Omicron, which you earlier highlighted, which was BA2. We have even have sublineages of BA2, which would be the BA2 12, and now we are actually seeing BA4 and BA5 actually presenting. In point in time, they are not considered to be variants of concern, because we do know that Omicron is a variant of concern, but they're considered variants of interest. Why is that? Because we don't really know how they affect as well as the severity of but the earliest data that we have out in the research pool, the scientific community, is actually showing that these two new subvariants potentially affect the lower respiratory tract. So now is really not the time to essentially dismiss the public health interventions, those non-pharmacologic interventions that we have spoken about quite often in terms of hand washing frequently, keeping your hands well sanitized, making sure that you wear a mask, especially when you're in a public space, and continuing to maintain that social distance. Yes, we have to continue to perform the normal activities of daily living. However, it is extremely important that we do so safely. Not to mention, vaccination has still been shown to actually work. Vaccination is the way away from severe respiratory illness and death. And I think that that's very important because one may even argue, well, you know what, Doc? The majority of persons may get COVID and have no symptoms during their acute phase of illness. But then it brings out the other question of long COVID, or what we call the post-acute sequelae of COVID. And certainly it also has an impact, vaccination, when I speak about it, has an impact in terms of reducing the possibility of one actually having some of those long-term sequelae, which can essentially impact one's quality of life. So we want to ensure that persons are going out there. If you have met the time period where you should be getting vaccinated, please do go and get vaccinated and continue to wear your mask. It does help.
What about the boosters? I had my booster. Are we doing a fourth? Because I heard other countries, I know someone actually who's done 5, not here. She started here. She had 2 AstraZenecas and 3 Pfizers, and might I add, she still caught COVID, but she wasn't ill, and older than I am. She's in her 60s, and she actually did quite well. So you want to let us know the importance of, again, to hit home. It doesn't stop you from getting COVID. I think we are all clear on that, correct?
Right. Correct. It doesn't stop you from getting COVID, but certainly it does minimize the possibility of you having a severe adverse outcome with severe illness and possibly death. Yes, we do have the 4th shot, or the second booster, available, and are offering that at this point in time to persons in the elderly age group, as well as persons who are high risk. So for instance, our chronic kidney disease population, any person who's considered high risk, we want to ensure they are well protected. WHO has actually stated, that it actually helps. And we have seen that there are some, for instance, nursing home facilities that may, from time to time, have positive cases in those nursing homes. Those persons who are vaccinated, they tend to do a lot better. So we want to encourage persons, really, if you do have any family members within your household that fall into that at-risk category, may they be elderly or have some chronic disease state that would essentially make them immunosuppressed, we want to really ensure that we protect them as much as possible.
I don't know if you're part of the policy making, but I would imagine the input from from you guys would be welcome, or is normally welcome as it pertains to government and the COVID rules. On Saturday, I went to a wedding, and by the way, just so you know, because I spoke to Dr. Grandison about how much time would I need to do a test, because I was exposed at that wedding. We didn't know until the very next day. And the test results are negative, Dr. Grandison. I did the test yesterday, and the test results, I dodged a bullet, I guess. But the question is, when we are telling people, okay, vaccinate, and we're having functions, and we're saying, you know, people who are vaccinated don't need to be tested, and then there are those who are not vaccinated that need to be tested. I'm not quite following the logic with that, because I'm thinking that everybody should be tested. Because I mentioned it because at the wedding I went to, you were required, most of us there at the wedding, we were all vaccinated, but the 1%, they weren't, and they had to be tested. But the person who came down with COVID at the wedding was vaccinated and could have impacted those who were not vaccinated. I guess my question is, why isn't everybody just testing, period, for events? What are your thoughts on that?
Certainly, it is a very, very valid question to ask. I do say that I would recommend that you actually speak to probably our CMO on that matter, but I completely understand and appreciate the question, simply because, again, the vaccine really doesn't stop you from becoming infected, but certainly prevents the severe disease and death. It also allows you to, in most cases, what we have persons that are vaccinated, they generally tend to clear the virus at a lot faster rate. So if I had to hazard a guess, possibly why the difference in terms of the testing requirement simply is because of what we know about the vaccinated versus the unvaccinated in terms of clearance of virus. However, I think that that's a question you may need to directly ask the powers even higher than myself.
No problem. I certainly will be reaching out to the CMO after this show, but we will come back after the break. We're going to talk about home isolation. We'll be back. Welcome back to Face It and Fix It. We're speaking with Dr. ADANNA Grandison. During the break, I had a little joke because I do have a slight sinus drip. I was tested negative yesterday, but I suffer from sinuses. So I was just saying that when you hear things about COVID and all of a sudden the slightest little thing, I'm thinking, oh my dear God, so should I get another test when I leave here? It's like someone telling you about a rash and itchy skin, and you're watching it and you just start to itch. So it's in my head. Thank you very much, Dr. Grandison, for putting that one in my head, because I'm here clearing my sinuses during the break. So before the break, we said we wanted to talk about home isolation and home quarantine. Do we still do the home quarantine, or we go straight to isolation? How does that work?
So we're really responsible for home isolation.
Okay.
And that is the confirmed COVID positive patient. The patient that has tested positive by PCR. We know that there are some persons out in community are either forming a rapid test from a, even at time in a home rapid test. These two testing modalities do not allow you to enter isolation program And therefore, in the event that we need to escalate care, if something happened to you, it causes a bit of delay in terms of getting you expedited through the system. That is in terms of home isolation. In terms of home quarantine, we will from time to time still have persons that we know will come in contact, even within the household, to some person who is a confirmed positive COVID patient. And those persons are required, usually from the date of last exposure or the date of positive test, to quarantine essentially for 3 days and retest on day 4. The only persons that we essentially would have an extended quarantine period are those persons who have dependents. Since if you are COVID negative and you are taking care of a minor and you have to be in very direct contact with them, which continuously increases your risk of contracting COVID, or even an elderly person, those persons then would be under an extended period of quarantine. But certainly, generally speaking, you can retest on your day 4 and then return to your normal daily function.
So the duration for isolation is what? Still 10 days after the test is positive?
At minimum 10 days, that is correct. And it's simply because we will not discharge out someone who is severely ill or some person who's at some point. So it's at minimum 10 days. So once you essentially, especially under the new model of the program, if you are assessed initially and you are considered to be well, and during that 10-day period you have never flagged or requested intervention because you are now feeling unwell, you're concerned, and you request to have an assessment, you will automatically be discharged at the 10-day mark.
Okay, so I want to mention something pertaining to the common cold, and it's not COVID, and influenza B to be exact. I understand that we've had quite a few cases of people, the cold is still going around, I would imagine, especially now that we've opened up completely, even though we're supposed to wear a mask. Are we seeing a lot of the other flu-like symptoms, and exactly what is going on with that, if you have any information on that?
Remember that every single year, Joyanne, around this time, typically we will see cold and flu cases presenting. This is just based upon the normal seasonality of flu season, and that is why generally around, starting as early as sometimes October, we try to, for instance, the flu vaccine or the flu shot, so that by the time flu season is full on its way, and we tend to see initially influenza A, and this is in the international context, and then coming on down to the tail end of the actual flu season, we start to see influenza B cases presenting. So it doesn't surprise if it is that persons contract flu this year versus, let's say, 7 years ago during this period, because this is something that generally happens during this time. Earlier in the year, while we had our cruise tourism period, you would notice that persons would potentially present with a bit of gastroenteritis during that period. And again, this is a seasonality picture that we tend to see for this particular illness. So in as much as we do have COVID within this space, there are some other bugs that every single year we have to battle with. The common cold, the seasonal flu, as well as the presentation, usually in children, of RSV, which is respiratory syncytial virus. These are all respiratory viruses, the last 3 that I spoke about, and they can all affect anyone. And that is why it's even more important that if you think you have any deviations from normal in terms of your respiratory baseline, or you're having fever, or your body's aching you, that you really try to get that testing so that you know exactly what's going on, so that if you need to get care, we can intervene early.
And in order for you to intervene early, then we have to communicate, obviously, to persons like yourself. What are some of the symptoms? If you just had a COVID test, it's positive, you're feeling well, but 2 days later, you start feeling unwell. What's the first thing you're supposed to do? When do you know, I need to get out of this house, I need to get to a doctor, I need help? At what stage?
Well, the first thing that I'll say is anytime that you're feeling unwell, and feeling a subjective thing. For instance, we all know there are some tough mummies, for instance, out there that may have a little sore throat or feeling a little under the weather and would be like, okay, I can really tough this out. And then there may be someone that may have a sore throat and say, oh my gosh, I really, really need to see a doctor immediately. And we respect that. If you have any symptom at all that you are concerned about and you wish to have it assessed, certainly you're concerned for whatever reason, or you have a family member and they're having symptoms, then certainly you can 36800, which is our hotline, and request the fact that you are concerned about your symptom, whether it is COVID related or you are a positive COVID patient, but for instance, your blood pressure is elevated or you can't get your sugars controlled. That is really a patient that we would want to see as well. So it's no longer just the shortness of breath, difficulty breathing, chest pain, but any of the symptoms associated with COVID. And I think I'll go over those so that persons really know.
Yes, for sure.
Any muscle aches that you may have. A lot of persons are complaining of backache and legs feeling very crampy. If it is that you're noticing that you're feeling very tired, certainly a fever, generally feeling unwell. Some persons may even complain of dizziness, and this really has driven why we have stated over and over the importance of staying hydrated. If you notice any changes in the color of your urine, so your urine is supposed to be really that nice light yellow straw color. But if you're noticing that now your urine is getting a little darker, looking a little bit more concentrated, foaming, these are all reasons why you may say, you know what, I think I probably need to get some help. If you're now experiencing any episodes, or your family members have noticed any episodes of you losing consciousness, so you've had a fainting episode, it is not a matter of saying, oh, maybe I just got up quickly, or, it's just something that happens. This is something that really needs to be investigated. Consistent nausea and vomiting, diarrhea, or especially in the cases of the pediatric population, those little ones, if they're not passing as much urine in their Pampers as you're accustomed to, if you, for instance, you're changing nappies, 4 nappies, 5 nappies in a day, but now you're noticing, the nappies are not really as wet as they usually are. My little one is really not the busy body that they usually would present as, and they're now really starting to draw under me. That is an indication maybe I need to see someone if the person is not eating. And then we have the very severe symptoms. For instance, that chest pain, shortness of breath, difficulty breathing, or unresponsiveness that a family member may show. Absolutely all reasons to call in and request assistance.
So what's that number again? Because it was a little broken, you said. And what's the number again?
Sure.
Could you repeat that number?
Sure. 536-1800. So that's 536-1800, and that is our home isolation hotline number.
Only for persons who have already been diagnosed and said, look, so you have COVID, you're in isolation, and not for people who have not been diagnosed with COVID but feeling COVID symptoms. So that number is not for those persons.
I will let you know, Joanne, that we have had persons who are not COVID positive, but certainly experiencing COVID symptoms, and we can assist you. We may not be able to route you through the assessment center, but we may be able to assist you in getting help, because at this point in time, the priority is get help for the patient who's symptomatic and feeling unwell. And so we may be able to advise you in terms of what intervention needs to be made. However, if the symptoms are minor, it may make some sense to try to get that positive test and confirmation of what's happening. But certainly if you are not known to be COVID positive, but you're constantly having that vomiting, the diarrhea, and now you're feeling very dizzy, I am not recommending at all, and I want to make this absolutely clear, I'm not recommending that you sit down and say, well, you know what, I'm not going to call that hotline because I don't have a positive test. Please call, let us know so that we can still help you. It may mean that we may need to maneuver a little bit in terms of getting you the care that you need, probably at the Queen Elizabeth Hospital, but certainly we still want to help you in any situation.
And, well, speaking of the QEH, and I don't want to put you on the spot, they have actually still seen well, obviously there's some persons who still need to present at the QEH, and certainly they're not turned away because, as you said, they can call and they can be assessed at the QEH and not to find out if they have COVID, I should say. Queen Elizabeth Hospital is still an option. Is
yes,
that correct? Okay.
For the more minor symptoms, we would prefer that you don't present to the Queen Elizabeth Hospital. Our Queen Elizabeth Hospital is the sole tertiary institution that we have that is publicly available. And we do know that certainly it is a stalwart of our community. However, it is being stretched essentially in terms of resources at this point in time because we're getting non-COVID cases presenting and COVID cases presenting. And so to the extent where possible, where COVID cases have to present, we prefer to direct them away from the QH and have them present to the specialized facilities that we have for COVID patients. And again, that is why it's so important to be tested so that you can be routed appropriately. However, we do know that there are some cases that we still have to present, for instance, to the Queen Elizabeth Hospital so that they can get the specialized care that they need. But wherever possible, please get your testing done so that you do not have to, for instance, sit and possibly wait, but you can be directed to another facility where you can test and your care can be expedited.
Basically, and that would be Harrison's Point, if that is the case. If you're really sick.
Harrison Point, if severe, or the two other assessment centers that we have on the island, which are usually coordinated transportation, whether you're given the opportunity to drive there and present there, or we actually pick you up at a scheduled time essentially for a presentation. But we try to discourage persons from just simply turning up at these centers simply because we don't want you sitting and waiting. We want that you're seen relatively quickly.
Are you happy for what you're seeing? The doors are open up, people are still going out. What advice can you give to the public as it relates to the spread of this virus? I can tell you, apart from that wedding, I have not been anywhere, maybe to a small bar in the corner by myself or with someone you know. But we have crop over coming. We've got, people need to make money. How can we best control this and still live our lives in the entertainment side of it?
I'm saying just play it smart. I think that everybody really needs to have a personal responsibility at this point. I understand that you need to have taken social events. I get that. It's all part of having daily life and feeling well. However, I want to say that you actually do it smartly. So, for instance, if you are going to be going to a bar or a space where you know that you may potentially have lots of persons, try to find that quiet corner, as you said, before, for instance, you may lower your mask. Essentially, try to stay away from that very crowded space that probably is air conditioned and have your mask down, because it really increases your chances of contracting COVID. SARS-CoV-2 is at this point in time ubiquitous in community, and it is almost very difficult for you to get away from it if you are found essentially in that type of environment. So being smart, I think, is really what counts. Essentially, I think that at this point in time we really need to practice wearing a mask properly. Wearing a mask properly significantly helps. I can tell you that any of our healthcare workers that have interfaced directly with COVID, seen patients with COVID face-to-face, can tell you that a mask really works. And so I really encourage persons that if you have to go out and if you wish to go, that you really do it smartly, sanitize. And where possible, stick to well-ventilated, open-air spaces, simply because you tend to have the chances being decreased in terms of you becoming infected.
Speaking of masks, I came in this morning, and from time to time we get mail here or a lot of WhatsApps on my phone, and someone took the time to send this express mail service and a handwritten letter to myself about the show. They're saying here, congratulations on the show, well done. And they watched the show. They said, I would appreciate your assistance in finding a mask. Exactly like the red cloth mask you demonstrate on CBC TV8. Now, I did an ad for the PMO, and they still run the ad. And they would like to see if they can get some of these cloth masks. So when we say that these types of shows and ads are not, to people are saying you're saturated the whole thing and you're overdoing, I say no. I say we're doing what we're supposed to do, because for someone to send this express mail, to hand write a letter, to say that and to ask about some of the cloth masks, but make reference to the ads, says that we're doing, we're on the right track. We're not on the perfect track. I don't think we'll ever be on a perfect track, but we will continue to be on the right track. We do have some more questions though for you, if you can stay with us. We do have to take a quick break, because we want to talk about the dashboard a little bit. And some people are saying, why are we still sharing the numbers? Your take on it. People are saying if this is what we have to live with, then we shouldn't even be sharing the numbers. So I want your take on it, and I certainly would like to share my take on every day. We see on the Government Information Service, everybody's like, oh my goodness. And then some people just don't care. So when we come back after the break, we want to talk about that. We'll be back. Welcome back to Face It and Fix It. If you're now joining us, we are speaking with Dr. ADANNA Grandison. We're talking about COVID-19, where we are now, the new variant, and those numbers on the dashboard that seem to be climbing up and up and up. Now, I can tell you there are some people who have absolutely tuned out of COVID, except for they maybe just wear a mask because they have to go in public. They don't check for those numbers. How important is it, as a doctor, how important is it to share that information on a daily basis?
I think it's very important, simply because it allows persons to know essentially where we are going. When it is time for you to essentially probably put in a few extra steps in making sure that you continue to be safe. I know that quite often, especially after the first year and a half, we have started hearing about COVID fatigue. Persons are becoming very nonchalant about, presenting with COVID. And generally, when persons tend to relax, in terms of relax those measures, that's when they are potentially exposed. And certainly having the dashboard, and I know that a lot of persons usually look at the exact number of positive cases that they may have and say, oh dear, we've had 500 cases today, or we've had 300 cases today. And I think that what is very important is really looking at the proportion of positive cases to the total number of tests undertaken. And that gives us our positivity rate. And it really tells us exactly what is happening. I think also having the dashboard and actually showing our vaccination numbers sort of punches home the importance of really getting vaccinated. I know a lot of persons have said, but if you look in some of the other countries, up north or even in Europe, essentially they are no longer wearing masks. But if you look at their vaccination rates, they're actually significantly better than ours. And so some of the measures that they may have put in place, or relaxed rather, are simply given the context of what they have, or what the participants of their population have undertaken, for instance, vaccination, which is quite a bit different than what we have here. So,
do you have the data with, not exact data, but you said that they're doing well. What about the deaths related to COVID and those vaccinated? Are we seeing that number being reduced worldwide? Not the spike. We know it's been spiking, but we're talking about the number of deaths in COVID for vaccinated persons.
So I know overall the deaths related to COVID has dropped internationally. With, I think that was about 4 days ago, Dr. Tedros would have actually given a press briefing, actually stating that those numbers have significantly dropped, I think, over the last week, when they actually look at the data. In terms of further drilling down the difference between vaccinated and unvaccinated at this point in time, I don't have that to hand. But I can tell you that persons, countries have made decisions simply based upon the context that they have, and that is really, you know, what measures they have put in place, the amount of reporting that they have, the amount of testing that their population is really participating in, the ease in which persons are willing to report their symptoms. All of these are things that make for a better space and for easier monitoring of a situation. So I think it's very important that the dashboard is there. And even more important that we really use the dashboard to help us tweak what we may need to do as individuals every single day to ensure that we stay safe.
Yesterday when I had my COVID test, I was told that the rapid tests are not included in that count, because after you have a positive rapid, normally you should go and get the PCR test. So, and I know that there are some people who are testing themselves, not saying anything. So realistically, the numbers on that dashboard obviously only reflects who comes through the system.
Yes, so the numbers are on the dashboard are for confirmed COVID positive cases. And that's why we want to ensure that persons who do have a rapid positive test, that they actually follow on to confirm their status. It's extremely important. And it's not that, for instance, the Ministry of Health is trying to hide numbers, but the rapid test is a screening test. It's a test just to see if there's something there. Even if it is positive, we want to know exactly how much is there. How can we think about possibly how severely this person may be impacted? And so that is why we have encouraged persons time and time again, please go out and really know your status. Also, there are some persons who would present and only request a rapid test. But remember that the rapid test is really for that symptomatic patient. The likelihood of you not having symptoms, taking a rapid test and it giving a positive result is low. Not that it can't happen, but it is usually very, very low. And so the testing modality that we want to encourage those asymptomatic or pre-symptomatic persons would be the PCR test. If, for instance, you have presented because you have symptoms and you've gotten a rapid test and the rapid test is negative, I still recommend that you continue through with the PCR test to know exactly what's happening. Because the PCR test is really that confirmatory test that's looking specifically for the virus, but also amplifying the sample to see if there's any small amount of the virus that we can actually detect it.
So let me ask you about the viral load quickly, because we have a long WhatsApp here to read. Depending on the viral load, it depends on how contagious I can be. So if I get a PCR test, I'm positive, but the numbers are I don't know how, if the higher the number, the lower it is, or the lower the number, I'm not quite sure how it works. But let's just say the viral load is very low. Does that mean then I'm not contagious?
Okay, so that's a really good question. So you're asking about the cycle threshold, or what we call the CT value. Generally speaking, the CT value is higher in two scenarios. Either some person who has old infection, or someone that we have caught very early in their disease journey, essentially, a very early detection of the actual virus. As the person becomes more infectious, their CT value goes down. What we have noticed is usually when persons go into the 20s and the teens, sometimes the single digits, that's when they will show symptoms. If we have noticed that a person has received a positive PCR test and the CT values are high, so they're in the 30s and they're concerned as to whether is this early infection or old infection, then we always recommend for that person to repeat the actual PCR test. And it's very important that you do that so that we're not just looking at a snapshot in time, but now we're actually looking at a trend of results so that we can actually determine if you are truly infectious or is this an old infection that we're looking at.
Now you're sending me back now to go and do over my test because I'm here wondering whether or not it was good enough. But let me then ask you this question pertaining to these quick tests. Now that, you know, we say that it's okay to do the rapid. People are traveling, but that doesn't mean that negative does not mean negative. So by the time, this is how tricky this virus is, because you're going to do a rapid test, you can get on the plane, and you can spread the virus if you turn out to be positive. That's basically the reality of it. Is that correct?
So the thought process is that the rapid antigen will detect some person who's infectious. Okay, that's who we're really trying to pick up. And it's simply because persons that have lower CT values generally tend to present with a positive rapid antigen test. Not to be confused with a rapid PCR test,
okay,
but a rapid antigen test. And so the rationale behind having taking a rapid antigen test within a 24-hour period of your travel is because you definitely want to ensure you are not infectious while you're on the plane.
But you can still have it, right? You can have it, but you're not.
Exactly.
Okay, that's good to know. So repeat that for the ones in the back. So let me go again.
So the rapid antigen test, and it's important for the timing. The timing is very important. That you have that test taken as close to your travel time. And it's simply because we are trying to ascertain, are you infectious during your travel period, where you would be on the plane in close confines with persons where you can potentially expose someone. It does not mean that you do not have SARS-CoV-2 and your body is not actively replicating it. So we have had persons who have had, for instance, a rapid negative test on travel and then 2 days later develop symptoms. And when they test by PCR, they are now COVID positive. So the rapid test, and that is why we keep saying if you don't have symptoms, we strongly recommend you don't take the rapid test in community to determine if you are COVID positive, because there's the possibility that it will be negative.
So even if the time of exposure exceeds 3 days, let's just say you took a rapid test 5 days after that you were possibly exposed, 5-6 days, would not be able to tell you for sure if it's there or not?
Remember that there is no hardcore cutoff time for replication. For instance, I could be exposed to some person who is COVID positive, and I have been infected with SARS-CoV-2, and my body replicates the virus at a rate that I become symptomatic on day 3. You may have been standing right next to me and you were also infected with the SARS-CoV-2 virus, and your body replicates the virus at a rate where you now become symptomatic at day 6. It's possible. And if you remember very early on in the presentation of this disease, that's why they spoke about things like incubation windows and incubation periods, simply because everybody's body is not going to respond the same way. And so we want to ensure that's why your retest that you will do after exposure on day 4 is not a rapid test. It is a PCR test. Because even if there's a small amount of virus there, the PCR test will detect it.
Okay, well, again, Good to know, for sure. I encourage people to go and get tested. Now let's get back to the vaccine now and the fact that we're not seeing a lot of people. I can tell you that on the dashboard we don't see many children. Obviously the adults exceed the numbers. Why is that? Has the science changed? Anything we need to know? COVID is more leaning towards adults more so than children, because we don't see the numbers that high in our children. Do we have any data to sort of justify why that happens?
Just want to confirm, you're asking about the number of positivities within the pediatric population, or the amount of children vaccinated?
Under 18. Okay, let's go that first one. Let's go with that one first. 18 years and older, the numbers we see are much higher. Under 18, the positivity rate is lower amongst children. Is there any data to support why that occurs? Why that is happening?
Why we're probably seeing that? We don't have data at this point in time to say that, but I can tell you anecdotally what we are observing. Generally speaking, the little ones tend to bounce back a little quicker. So they may have that symptom for 1 day or two, and then everything appears well clinically to parents. And so they say, oh, well, my little one probably only had a fever for a day, but they don't have it anymore, so I highly doubt it's COVID. And so they never follow through with getting that test. And so they may be positive, but they may not show symptoms as much as an adult may show symptoms. So they're not presenting as much for testing as, for instance, an older person who may start off having a fever and then may start to then get the muscle aches and the body aches and the chills, and it continues usually probably until around day 5, day 6. So that is one observation that we're seeing. So we just want to encourage persons, especially if they are those little ones are in the household of a COVID positive person, still get them tested, even if they may not be showing symptoms. After all, they're still a primary contact, and we still want to get them tested on day 4. I know that there are also some parents that are very concerned, oh, I really don't want to subject my child to the discomfort of having that test. Remember that even very early on, we noticed that the children didn't have initially a lot of severe symptoms with the acute COVID presentation, but they are, although it is rare, they are at risk for developing MIS-C, which is that multi-symptom inflammatory syndrome that they can present as with children. Now that is essentially, I guess we could call it the equivalent now that we know of long COVID, and it can cause a change in quality of life, and sometimes those symptoms can be very significant. So please, we want to ensure that those children get tested, because you may have missed the initial fever or something like that, but then a few weeks later the child is now presenting with, let's say, a fever or a rash, and you probably delay sometimes in accessing that care that the child may definitely need. That may be the MIS-C presentation.
So we got to get this to this WhatsApp, but this would then lead me to the question, because it was a twofold. Children being vaccinated between the ages of 12, 17, have we seen an increase, or we're still struggling?
I think we based upon what I had last, I'm subject to correction because I haven't looked at the dashboard within the last few days, but we are still seeing that lag of children presenting for vaccines. And I think that there's lots of vaccine hesitancy in community. I mean, we're now 2.5 years, probably close to 2.5 years into this pandemic. We've had vaccinations here for quite some time, and we know now that these vaccinations work. We have seen persons that have been vaccinated who have no other underlying illness, and they have contracted the virus, as you stated, even your friend who's a lot older than yourself, and did not have very severe presentation of illness. We do know that there are some persons who may be vaccinated, contract COVID-19, and they may still essentially decompensate and die. But the question to ask is, are there other comorbid conditions that they may have had that may have made their outcome worse? And those are things. We're not really in the game of death shaming, but we really want to encourage persons to really get vaccinated. Okay,
well, let's get this WhatsApp up quickly because we have about 2 minutes left. And the WhatsApp here says we get it put on the screen. We can get it up shortly. We had some residents and staff members tested positive last Thursday. Residents are all doing well and reaching the end of their quarantine period at the nursing home. However, I now have 4 staff members who have tested positive, a rapid at the same time, but I'll go over that because it might have been a typo, at the same time, but went to get their PCR on Tuesday. They went on to say their 10-day quarantine starts. My concern is that the nursing home is very short of staff and we are struggling with no help at all from anywhere. My staff were at work and asymptomatic. Can they be now reassessed after 4 to 5 days so they can come into work if they are well and have no symptoms? And I believe that we should read when I said earlier, I now have 4 staff members who tested positive with a rapid test at the same time, but went to get their PCR on Tuesday. Is there anything you can share, ADANNA, Dr. Grandison, on this one?
Sure. So a patient or a staff member in this situation who may have tested positive on a rapid at a particular time, I strongly suggest that you immediately follow through and get a PCR test. That's the first thing. Don't wait until day 10. However, the persons have gone on to have their PCR test on day 10. Certainly when they are assessed by Ministry of Health officials, I would strongly suggest that they should allow them to know that they would have had a rapid test that was positive and the date of the rapid test. Based upon that, they may look at the CT values, because that's why we use the CT values, to determine is this new infection, is this old infection. They may even ask them to retest to see what the trend of the CT values are, because it may not require that those persons actually spend an entire 10 days in isolation. So first of all, we want to encourage you that if you get a rapid positive test, don't wait for day 10 and then do the PCR, because the PCR is not a rapid. If it is that you are positive, slightly positive, even in the least bit, it will be positive. So I want to encourage you, if you are rapid positive, take the PCR test at the same time or at the earliest possible time that you can take it, so that you do not have an extension of your isolation period. However, for those particular persons who would have done the test many days after obtaining a rapid positive test, then that is an individual conversation to have with the Ministry of Health officials so that we can assist them as quickly as possible.
And the last part of that WhatsApp, I believe they asked if they have to do the full 10 days after the 4 to 5 reassessment. If it's reassessed, do you sort of do the restart of the clock again?
So that is why we definitely look at the CT value, because they may not need to do the full 10 days post the PCR test, but we would not be able to make that determination based upon a single PCR test. We may ask them to repeat the PCR, repeat a rapid and a PCR to determine exactly what's happening, so that we can trend their actual values.
One person's asking, good morning, how soon after being infected can you have a booster shot?
So we generally recommend that persons who are minimally symptomatic or asymptomatic can get that booster shot as early as 1 month. Or persons who have had more severe symptoms, that you wait a little longer and probably get that booster shot within 3 months, simply because you don't want to have your immune system highly activated and essentially trying to get over the illness presentation, and you're now superimposing a vaccine on top of that, which would mount an inflammatory response as well. So we want that inflammatory system to essentially settle a little bit, and then you can get the actual shot, which will cause a slight ramp up in terms of your inflammatory response, but it should not be something that essentially overwhelms your system.
I'm thinking that in order to get some persons on board with the booster shots at least, because even that, I know that some persons who did the 2 and didn't bother with the booster, which kind of wasted the whole exercise, because I thought that was important. But perhaps maybe the CMO, the Ministry of Health, could show more persons who had COVID vaccinated with comorbidities and survived because they were vaccinated. I believe that is the direction that we need to go in order to maybe increase the whole vaccination process, get people to comply. and to just take the vaccine. Closing words with you. And while you close, I just also would love for you to reiterate that the vaccine is not a cure. It does not stop you, but reduces illness and death. In your closing remarks, if you can repeat as well. Oh, one more question I'm getting here quickly, and they want to know if you can sort of go over the self-care in home isolation as well. So there's two things that you have to wrap up on.
Okay, so self-care and home isolation, and it really, I don't think that we can possibly say that it is specifically related to COVID, but any illness that you get, you want to ensure that first of all you're eating well, and I am a foodie, so I advocate very strongly for eating well. And eating well doesn't always mean simply eating foods that taste good, but they need to taste good and they should be very good for your body. So you want to get those nutritionally dense foods in. You want to make sure you're getting all of your micronutrient content. So your foods that are high in your vitamins and minerals, and certainly you're going to be making smart choices in terms of your proteins and your starches. Okay, for those persons who may not have an appetite and may say, but doc, you know, I really don't feel like eating, I don't feel so well, at least ensure that you are getting in your fluids. And I know quite often we think, okay, I am feeling dehydrated, I need to have a large bottle of water all at once, or I need to have a large cup of juice all at once. I'm saying just take small sips every 10 to 15 minutes, slow and works. You do not only need to use, for instance, water. You can use other fluids, you can use soup, you can use Powerade, you can use Gatorade. For those persons who are diabetic, I strongly recommend that you be very careful about the sugar content within the actual fluids that you're using to rehydrate yourself. Certainly, if it is that your fluids that you're putting in having excessive amount of salt, you will now be further dehydrating yourself. Stay away from alcohol for the period of your illness. Alcohol actually causes inhibition of our antidiuretic hormone, and it causes you to go to the bathroom more frequently.
Not even a glass of wine?
Not even a glass of wine. Not even a glass of wine. I know it may taste good, but we want to ensure that your hydration status is optimal. Okay. If you are not eating or drinking well and you can take vitamins, by all means, supplement with your vitamins, getting your vitamin C, your zinc. This is not going to change immediately your outcome, but what it does is that it provides the building blocks that your body requires to help recuperate from this illness. And certainly during your isolation period, a lot of you may be feeling tired. Don't take the opportunity to say, you know what, I'm going to tear down this entire house and clean it. No. Take the opportunity to get the much needed rest that you probably were not getting before. We generally tend to find that persons who don't sleep well, who don't get enough rest, because rest, water, which is hydration, and certainly eating well, those are the pillars of good health. So persons who are not sleeping well and not getting enough rest, their bodies doesn't have the opportunity to recuperate and heal itself. So we want to make sure you're resting. Don't take the opportunity to find all types of things. Stay at home. Do not go outside. Do not attempt to infect others. Be responsible. Certainly, if you have persons within your household, it does not mean that your family members are required to kick you out of the house. This is not the plague. Certainly, this is something that you can stay within a household and you can be without COVID for the entire period of time as that family member who is in a household with some person. It just requires that you wear your mask. I cannot harp on the fact of wearing your mask, and not just putting the mask on and halfway having the tip of the nose out or anything of the sort, but wearing your mask properly, ensuring that there are no spaces in your mask when you blow out. So if you're feeling air hitting your eyelashes or your glasses are getting fogged up, you're not wearing your mask properly. And then certainly washing your hands, all of those high contact surfaces, the door handles, the actual flusher on the toilet, your kitchen counters, your tap knobs, all of those spaces.
I still wipe off my groceries and the cans. I do, so that my daughter helps. So we wipe them off first, and then we hand them to her to think. But we do have to wrap up. 30 seconds. Final words.
So get vaccinated and make sure to put on your face mask, wash your hands, and social distance. Play it smart out there, and let's continue to be safe and eat well.
Thank you so much, Dr. ADANNA Grandison, and a special good morning to all of you in home isolation. You've got Dr. ADANNA Grandison on your side looking out for you. We could not ask for a better doctor, and very deserving of that award that she got recently. When we come back, we're going to talk about climate change, and the Caribbean Youth Environment Network will also join us. We'll be back after the break. Welcome back to Face It and Fix It. As you know, it's Friday, GCF Fridays, Green Climate Fun Fridays. As promised, every other Friday we will be speaking about climate change, what the things that we have to do to fix this problem. And we normally have 5Cs on with us, the Caribbean Community Climate Change Center, and representing the center today is Mr. Alex Harewood, GCF Project Engineer, Program Development Management Unit, and that is from 5Cs. And joining us also is Mr. Reginald Burke, Executive Coordinator, Caribbean Community Youth Environment Network. First, we're going to start with Alex Harewood. Alex, welcome back to the show. You're no stranger to Face It and Fix It. For those of persons now watching for the first time, I'm going to ask you to give us a little synopsis about 5Cs, Caribbean Community Climate Change Center, what they do, and then we can move on from there.
Okay, great. Thank you for having us. Ultimately, the center, Caribbean Community Climate Change Center, it is based in Belize, but we're doing a project with the Barbados Water Authority, looking at the nexus between energy and water. We're doing several. The project is actually, the combined effort is being partially funded by the Green Climate Fund, which is based in South Korea. And this joint effort is total about 47 million US dollars, 27.5 million the Green Climate Fund they are providing. and we are doing a whole host of project activities. We are installing renewable energy technology at several Barbados Water Authority sites to cut down on their carbon footprint. We are also installing microturbines to to ensure that if we have prolonged power outages across the island, that water can be pumped from water stations to key areas across Barbados. And we're also investing in the capacity of persons working at the Barbados Water Authority, along with you, the public. We're also doing, we do endeavor to do several workshops and several programs in the near future, but we also would like to set up something called a Revolving Adaptation Fund Facility. So that would help homeowners and some small businesses to to it would allow them to access funding that they cannot for energy saving devices and water saving devices and those kind of things. So in short, that's just a brief overview of the project. It started in 2019 and is slated to end in 2024.
Okay. Exactly what is FP060 project engineer? Just have that in my
Okay,
notes.
well,
So I just want you to decode that for me.
well, FP060 is the designation that the Green Climate Fund gave when they approved the project in 2018. The Green Climate Fund is essentially a bunch of high income countries that recognize the issue that countries like Barbados and other smaller developing states face. We face a unique issue where we are dependent on fossil fuels, and at the same time, we are exposed to climate variability, right? So, all these extreme weather events, for example, um, drought, as well as severe hurricanes, those kind of things. So, it was established and fully set up in the mid 2010s, and it really allowed countries like Barbados to have access to funding, and this is grant funding, not loans. So we are given the 27.5 million to help our country.
Okay. On to you now. Reginald Burke is with us. Welcome, Mr. Burke. You're the Executive Coordinator, Caribbean Youth Environment Network, also known as CYEN. Welcome to Face It and Fix It, sir.
Thank you. Thanks for having me.
And thanks for being patient, as I know you've had some other things doing this morning. As we know, the Caribbean Youth Environment Network is a nonprofit network organization dedicated to improving the quality of life of Caribbean young people by facilitating their personal development and full involvement in all matters pertaining to the environment and sustainable development is what we understand this organization, NGO, to do. Tell us a little bit more about it, and is it only pertaining to the environment, or there are some other layers to the NGO or to this organization?
Well, as you said, sustainable development is really at the core, and sustainable development is more than just environmental matters. So there are a number of social issues which we also engaged in, even in the climate change sector. I mean, right now we are very heavily focused on climate justice, and that's to get young people generally to understand the importance of how their social condition impacts how resilient they are to climate change. So that's really the best way to put it at this point. It's more than environment, but it includes also social aspects.
Okay, so I wanted to touch on some of the social aspects, and then we're going to tie it back into the environment with 5Cs. Some of the challenges that are faced by the youth, we talk about things like unemployment, and we're looking at food security. I had the privilege of speaking to some persons, members of your organization, who talked about the backyard farming program and all these great things that you are doing. You want to tell us a little bit more about some of the other sustainable goals that you're looking at?
Well, the backyard farming project actually is more prominent in St. Kitts and Nevis. I should let you know that the Caribbean Youth Environment Network, we operate in the countries of the Caribbean between Suriname in the south and Belize in the north. In Barbados is a very strong interest in the area of water, and I think that's part of the reason that I've linked into this program. What we're trying to do is to get young people more engaged in the issue of water management, and to get everyone to understand that they're part of the process of water management as end users, as opposed to just people believing that it's only the Barbados Water Authority who manages water in Barbados.
Well, this is also quite true, because I've always said that the fastest way to manage your system is, in this case, in Barbados, we have a number of meters. All of our customers are metered, I believe at least 99% of them. And the fastest way to check to see if you have a leak so that you can do something about it and conserve is to spend, I always put it this way, spend 5 minutes of your time or $5,000 of your money, because unfortunately you do have to pay for water leaks here in this country. What are some of the things that we want our young people to know as it relates to water right across the Caribbean, and some of the best practices?
Well, the real issue is most of the Caribbean states have water issues, whether it is, in the case of Barbados being one of the most water scarce territories in the Caribbean, or it could also be in the case of Dominica or St. Lucia, that you get a lot of water, but it's a distribution issue in place. But the reality is that we kind of undervalue the importance of water generally as a Caribbean society, and it really is extremely critical that we understand as users of water that we have a very significant role in its management, and the role is really one of conservation. So we have to ensure that our young people are using water in such a manner that it is sustainably used and not wasted. Many years ago, you'd hear people talking about having showers. They would turn water on and turn the water off when they're soaping. But generally, the practice now is we just have the water running all the time. The idea is to get people to use water minimally, only for critical issues.
Okay, and Alex, Harewood, back to you with the work you're doing. GCF is doing, 5Cs is doing with the Barbados Water Authority as it relates to water conservation. I would imagine BWA would be driving this process in terms of a water conservation campaign with the assistance, of course, of GCF 5Cs. Is that something that we're desperately looking at?
Yes. One of the things that we're doing is that we are looking to boost the resilience of the entire water network in Barbados. So one of the things that we are actually, what we have done rather successfully with the BWA is replace about 22 kilometers of aging pipeline. As you know, pipeline over time has leaks, and some of these pipelines were in the ground almost a century ago. So having the reduction of, we call it non-revenue water, having that reduced actually will benefit the beneficiary, the customer, and will actually benefit the BWA as well. And that's notwithstanding the precious resource of water being lost. So that is one of our major thrusts in terms of putting doing capital works. We also currently embarking on a water tank project where we are installing water tanks across the island. Because some of the water connection issues does not necessarily happen at mains, it happens along the tail end of the distribution network. So we're looking to address water supply issues um, across from pumping all the way to the customer. We have also purchased 6 vehicles to help to further bolster the mobile water tank system that BWA has. And given the past year or so, where water has increased importance along with the lack of precipitation in some areas, we do recognize that it was well needed and well timed.
So as well as we can recognize that different islands have to do different things depending on the need and the problems. So Mr. Burke, can you share with us if you have any information on some of the other things that other islands are doing in order to win this fight? We may not be able to, as I said to people, the small island states don't necessarily contribute a whole lot in damaging the ozone and global warming, even though we do contribute something, but not a whole lot. But we are on the receiving end of the damage that has been caused and continues to happen globally. For example, longer droughts, storms, Category 5 hurricanes, etc. What are the other islands doing as it relates to water and water conservation in their respective countries?
Well, this is an interesting aspect of things. When we talk about storms, I don't want to just talk about hurricanes because last week there was a very heavy rainfall episode in Dominica and Martinique. The challenge is that we're getting more and more of these episodes of heavy rainfall, and it leads to a tremendous amount of runoff. So the challenge is how do we manage the runoff so that we can make the best of the water that's available. So that is basically, I think, what we have to look at in the region is how to manage these heavy rainfall episodes that we're having. In the case of Barbados, I think it is very important that we get people to understand, because I think there's a little bit of a laid back approach to water in Barbados. Generally speaking, is available to most people, and I know there are issues in some of the parishes around the country, but I don't think people understand the amount of subsidy that the government actually puts into the water distribution system. What we actually pay for the water system is not the real cost. So somehow we have to roll that back. I know, Alex, the project with the renewable energy is one way, but still we have to find other ways of ensuring that we use water wisely and that we understand the true value of water.
Very well said. Alex, back to you, as Water Authority being the entity responsible for the delivery of water in this country, obviously carries a huge responsibility in that regard. Do you believe, in your opinion, that how we handle water and the usage, we're a little bit too laid back in Barbados? You think we take it for granted?
Oh yes, I totally agree. I agree with Mr. Burke on virtually all the points that he had mentioned in terms of our opinion to water. Part of our thrust in capacity building and public awareness is that we provide materials during the World Water Day to schools, and some of those things include coloring books that are created with various stuff in terms of Barbados paraphernalia. So it's not necessarily off the shelf book. So we create a coloring book that highlights the importance of sustainability and the importance of our energy and water usage. So those are one of the areas where we're trying to tackle that view that water is not important by approaching this education system with the kids at a young age to try to instill that knowledge. One thing that we do endeavor to do as well is to use our public awareness campaigns where we can um, even liaise with CYEN to do further work in terms of public awareness, in terms of being more environmentally conscious, and in terms of really understanding how how much it takes to get water to your tap. So I totally agree with him on all fronts.
All right, we're going to take a quick break. When we come back, we're going to talk about the symposium 2 Fridays ago and the connection between 5Cs and CYEN when we come back after the break. Welcome back to Face It and Fix It. If you're now joining us, we are speaking with Mr. Alex Harewood from 5Cs and Mr. Reginald Burke from CYEN. Before the break, we mentioned the symposium that took place about 2 Fridays ago, I believe, at the Lloyd Erskine Sanford Center. Tell us a little bit about the symposium and Water Authority's role, not Water Authority's role, my apologies, 5Cs, GCF's role, and CYEN. Alex, I will let you start.
Okay. So part of our thrust in the to raising public awareness is to reach out to various NGOs and CSO, civil service organizations, to see how we can liaise with them. So we we had a couple conversations with Mr. Burke, and we decided to team up with this symposium. Water Day for this year, the theme was groundwater. Uh, we don't really think about groundwater, but groundwater is super important for Barbados because we don't have any surface water that we use. Virtually all of our water we abstract from the ground, we take from the ground. So we really wanted to have a partnership with a civil society organization, as well as bringing forth or highlighting what we're doing currently in our project and what others are doing at the BWA and in various organizations in terms of water and sustainability.
Okay, Mr. Burke, were you present at this symposium?
Yes, I was.
Okay.
It was a very interesting exercise. I think it's important because the majority of people who were at the symposium were what we call young people, who would be between the ages of 15 and 30. But I think one of the issues that I actually want to put on the table at this point is related to water and educational institutions. As we kind of roll out and normalize in the COVID setting where we're getting back into schools, it's very, very important that we have an idea of how water is being used in the schools and education institutions. So that would be universities and preschools and so on. Because young people do spend a significant amount of their time in these institutions. Maybe about, I assume about 8 hours a day in general. when you're in school. And it's really important to get them to understand um, how we're going to use water in the schools. I know in my time we did a few naughty things. We used to have water fights, and we used to find ways of wasting water, all in the good-natured fun. But we also have to look beyond now to see how we can ensure that we have the infrastructure in terms of the taps, the low flush toilets and urinals and so on, to ensure that we use water wisely in the school system, because a significant number of our population spend time in school. So that's a very critical thing that we should be starting to focus on in Barbados now.
Well, one of the things that I would like to share, having been at the Barbados Water Authority a couple of years ago, one of the things I recognize that people don't do, and I said it a little earlier, is to spend a few minutes. I believe they should do this once a week. The meters that the Barbados Water Authority installed, they're pretty easy to read, and if they're not, I'm sure there are people at the Water Authority that would be more than happy to show them. But if you turn off, and listen carefully, if you turn off everything in your home, on your water taps, make sure you didn't flush the toilet, even turn off the ice maker on the fridge, because that releases water. And you go outside of your house, and those of you listening, I hope you do this today. Go outside of your house and write down what you see on your meter. There's numbers and there's a point. Well, that's their measurements, okay? And if they can write down and spend 5 minutes, if it doesn't move, and the first number you see, and 5 minutes later it's the same number, then you don't have a leak. But if you see the numbers moving, one of the things that Barbadians can do and be so proactive and calling a plumber or turning off the meter, that would be the first, in my opinion, and based upon a little bit I would have learned, one of the first things that we should do is to check for leaks. Don't wait until you see a big bill. The Water Authority would not know that you have a leak until they actually go and read the meter. But you, the consumer, can do this maybe every couple of days, once a week. You just go out there and you check it. Alex, what would you say to these types of practices and for people at home to do?
I think that's actually a pretty good idea. That is something that I think the Barbados Water Authority put forward. I remember as a youngster, still relatively young, but as when I was younger, that was one thing that I remember being told, and that was I'm being instructed to do, looking for leaks, those kind of things. So those kind of things are some of the other things that we do endeavor, we would want our homeowners to do when we have that fund established, which is the Revolving Adaptation Fund, is that they can reach out to Barbados Water Authority and say, hey, I do recognize that I don't have some water saving devices. And once the fund is established, you'll be able to work out if it's going to be a small loan or if it's going to be a grant. So that persons will be able to not only, as you were saying, look for leaks, but they can further decrease their consumption. One place you can decrease the consumption, what Mr. Burke had mentioned, is your behavior in the shower. But you can also further decrease your behavior in the shower by having an improved shower head that would disperse the water a bit more effectively. So there, ultimately, yes, that those behaviors and activities are encouraged, and I agree. But further, we would want that when the fund is established through our project, that we'll be able to say that persons can go a step further and reduce their energy and their water consumption as well.
Well, I want to get to energy in a second, but I want to talk about these shower heads and the fact that even if you use those devices that they come on, if they're regulated somewhat. This is what Barbadians do. I think most people, there's hot water and there's cold water, and you need them to mix. And there's no way that you standing up under that shower until it mixes. So all of that water then goes down the drain. And people actually run water for, and 3 minutes may seem short, but 3 minutes of running water in a shower to spraying out until you can adjust the hot water and the cold water to suit you. And Bajans, I know you all know what I'm talking about because it happens every day. It's perhaps maybe a 5-gallon bucket underneath the shower to catch that water and use it then in the washing machine or to wet plants, because it actually gives you an idea how much water goes down the drain while you are waiting to mix the two. To me, that's one of the biggest water wasters on the domestic side, apart from washing the dishes and letting the water run. Your thoughts, Mr. Burke? I see you.
No, I'm here thinking because you did mention something which I thought was very important about people monitoring their water usage via the meters. Now, in Barbados, we have about, I think, 26 government secondary schools. And my question would be, who does this monitoring in the school system? Who does the monitoring at the primary school level? How quickly do we pick up? Yes. How quickly do we pick up things like leaks and so on? So that sort of surveillance that you are suggesting that we need to do in our domestic situations, that also has to apply to institutions. And so that is one of the areas that I believe is a gray area that we need to sort of relook at in Barbados.
Well, I think that there are some Barbadians who hit pretty hard with a huge water bill, and they don't make that mistake anymore by not checking. There are those who don't, and they do miss the leaks. And in most cases, they will tell you that they don't have a leak. Now, all leaks are not visible because you can see if a washer needs changing, etc. But certainly there are leaks underground and leaks in the walls that you don't see necessarily surfacing until your postman comes and you open up your water bill and you see $3,000, and then you have to make a payment plan at the Barbados Water Authority together with being current. These are the things, if they're not interested in the whole concept of climate change, which by the way, we have to continue to sensitize the public. But it's unfortunate that people don't adhere to certain things unless it's hitting them in their pockets. Not everybody, but that is one way to wake them up. But let's get back then to the whole concept of we need water to live. And we do, and it's the driving force for everything. A country can shut down literally if they have no water. Let's just say, God forbid, for argument's sake, here in Barbados, the Water Authority shuts down, every pumping station goes offline for days. The hospital is impacted, agriculture is impacted, life as we know stops. And I'm hoping people will let that sink in for a moment. If the water goes off in a country for a long period, life as we know it, hospital care, education, every last thing shuts down. And it's just so important that we start from that, because when you see people using water, for example, these standpipes in this country, fish being scaled at the standpipe, clothes being done at the standpipe, and water is just running down the street. How do we tackle some of these things? Metering a standpipe doesn't help. Mr. Burke?
No, it doesn't really help. But I think we have to get the whole issue of water usage and water conservation into our popular culture, because it's about behavioral change and people understanding why they do stuff. It's just like you talk about the water heaters. I mean, it's a convenience thing. We're very much into expectations of convenience. And we've gotten very accustomed to it. So what we need to do now is to find ways that we can manage change and make people change their behavior to be more responsible. So we have to make this thing somewhat of a cultural thing, a cultural input, so that people see this is like I don't want to say like a religion, but it's a practice that you have to do in your everyday life. So it's not until we get to that level that I think we'll start to see change.
I totally agree. And by the way, I want to say a special good morning to the people of St. Joseph, St. Andrew, St. John, and in St. Lucie. I always believe that they are better off in terms of how they manage water usage, because they're always out of water. And the people of St. Michael, I'm sorry to say, St. Michael people, if they're out for 2 hours, they're literally angry and they don't know how to adjust. But the people of St. Joseph, St. Andrew, St. John, because they've lived it for so many years, they know how to manage water. They actually know how to conserve water a lot better than the rest of us in the other parishes of Barbados. Alex, the people in the higher areas, the water tankers that were purchased by the GCF 5Cs, I believe you were present for the presentation. They were presented to you on behalf of, you presented them to the BWA?
Yes. Actually, those water tankers actually came, they were delivered by the contractor in a very timely manner. They actually came in at a point in time where there was a need to go out into rural Barbados to supply water to several parts of the rural Barbados. So the engineer from the Centre BWA, we went and we verified that the trucks were in working order and that everything was verified, and then they were officially handed over to the BWA to be sanitized and deployed. So they were deployed in, I think, less than 30 hours to the affected areas. So they actually came in and were processed to fill a need, a gap. So the whole water tanking, mobile water tanking system, they actually have a pretty interesting system in which they monitor and deploy the several water tanks. So I mean, on a given day, you might not see several trucks, but they have a significant amount of trucks, and our addition further bolstered their deployment. So yes, I was there. In short.
Yes, you were there. Actually, I want to issue a challenge even to Barbadians, because we have 5Cs on this show every other Friday. The idea behind it is to sensitize Barbadians about climate change, the things that we need to do to mitigate, adapt, all of these things that I must say 5Cs, with their help and the help of GCF, they were able to assist the Barbados Water Authority and in turn assist us Barbadians. So we on this show, we love to help. It's called Face It and Fix It. So I'm going to throw a challenge out to you. We're going to tweak it a little bit more as we go along, but every other Friday we're going to check the videos. I'm going to issue a 5-gallon challenge to Barbadians and see whether or not you can survive on 5 gallons of water. Now, if you don't know what 5 gallons is, it's a salt meat bucket. A salt meat bucket is 5 gallons. Perhaps if you shut off your meter and 5 gallons per person, and just see what it is like to get up, brush your teeth, have a bath, get something to eat, come home, get something to eat again, have a shower, and get to bed. See if you can actually manage with 5 gallons of water. I can tell you this, if you manage that, that will show you that you are wasting water on a regular day. Because in most countries, people actually take a shower, they have a bath, they brush their teeth, they have something to drink, and they even try to cook with a pet bottle, which is like 1 liter, and they still got water left back. So I'm saying that we will probably tweak it, Alex, but every 2 weeks we're going to put some challenges out there to sensitize people on the show as well, not only to the work you are doing, but also to the things that we need to do, a call to action. We have to act now. Water is not going to be here forever. And if the late Sir Charles is right, he told me he believes that the last war will not be in Ukraine. It's going to be over water, because of the way the world is going. We can run out. We literally can run out. You may think this is a joke, but it's not. So we do have to do all of the things to conserve water, and do it now. The people in St. Joseph can tell you what it's like. The people in St. Andrew can tell you, St. John and St. Lucy. They lived it. So please, we're going to sensitize you more and more. I'm going to have final words here, Alex, and then we're going to end with Mr. Burke. Alex, some final words at you.
What I would say is that even though we don't see water, we don't see the water as like rivers or lakes. Water is very important. We need it on a daily basis. We need it for life, and we need to look to conserve it, as well as the way how we look at energy. Look to conserve energy. We need to look at conserving water more. I think that's about it from my part.
Could you just touch quickly and wrap it up on the energy aspect of things? Because we really talked about water. Just a minute on the energy aspect of things that you're doing.
Okay, sure. Just to rehash, or just to do a skim of what we are doing on the energy front, we are installing 4.5 megawatts of PV systems at 3 select BWA pumping stations that will augment their energy usage and cut down on their CO2 emissions. We are also putting in 2 megawatts of natural gas turbines, and those will provide energy independence in the situation of prolonged power outage across the island. We would endeavor to have those pumping stations pump water in key areas across Barbados. So in terms of power, those are the two heavy hitters, I would say. And the last thing would be the establishment of the Revolving Adaptation Fund. When we have that established, we will be taking a portion of the savings from the PV and fund energy efficiency equipment and water saving devices.
Okay, and Mr. Burke, before you start, there's a WhatsApp just came here. Good morning. Sometime burst pipe was reported to the Water Authority a few weeks ago at Martins Bay rather, with no response, and water still spraying in the air all now. We're going to have that discussion in another 2 weeks because we want the BWA on, because we cannot expect to ask Barbadians to conserve. We cannot expect Barbadians to do that and then the entity responsible does not equally do what they have to do, and that's another conversation. Mr. Burke, we will share that information with the BWA rather. Mr. Burke, final words at you, sir?
Yeah, I think it's important that we get every citizen of Barbados to understand that they are part of the management process of water. So because if we over extract water, we'll have a problem with saline intrusion, and it's not the best thing when you have sea level rise going on. So we have to get people to understand how their used water is extremely important, and that they're actually part of the process. And even if you look at it from the groundwater perspective, what you do on the surface, how you dispose of your chemicals or your oils or whatever, that has implications of possibly seeping into the groundwater system. So we have to understand that as citizens or residents of Barbados, we have a very important role to play in its management, and that it's not vested solely in the Barbados Water Authority, but it's what we do as collectively as individuals within a nation that will actually make the water management process more important. and more vital. We are all part of the management system. That's my take from here.
Okay, well, that is definitely a good note to end on, because as I said earlier, and we will continue to advocate on this program every 2 weeks, we want to bring all of the members of 5Cs, including even the Prime Minister, who is the face of this fight, this side of the globe. She has been the face for the small island states in our argument. We do need to get young people on board, hence why the involvement of CYEN. It may be too late for some of the older persons who are set in their ways, but it's not too late for the young persons to be sensitized, to let them know our planet needs saving and they need help. So I want to thank you guys so much, and we're going to make sure that you come back again. I'm not sure who the guest will be 2 Fridays from now, but we know that 5Cs have got a lot of staff members there. So, of course, and we want to say a special good morning to Dr. Elonka Duggan, who could not be here with us, the point person, project manager. But I want to thank you guys so much, and we'll see you again in 2 weeks. Thank you.
It's a pleasure.
Thank you.
Thank you. Thank you. Well, as we're going down to the last few minutes of the program, unless I have to take a break, and I do, because I do have some parting words I want to share with you. We'll be back after the break. Welcome back to Face It and Fix It. We have about 3 minutes left, and I wanted to spend these last 3 minutes talking about mental health. It's such a serious problem. I don't think that we are paying enough attention to it. There's so many people in Barbados, and a lot of my friends and even family members that are going through some serious challenges. Sometimes you think that they're complaining or you know, they're going on and you're wondering why they can't snap out of it. But if you read up about it and you get more information, they're going through a situation that they cannot help. It's hard to describe because I'm not going through it myself, even though some days it feels really hard depending on your situation that you're going through, and you have to constantly talk to yourself. But I'm asking you to check up on your friends, see how they're doing. Even the ones, especially the ones that are the life of the party, the people that are always smiling and passing a joke. Because recently, the amount of people who have committed suicide, and some, one or two I knew, they were the life of the party and no one knew. They're now referring to it as high-functioning depression. In the States, you recently had Winona Judd, and you had Chesley Christ, a former Miss America, who jumped off a building to end her life. Ending your life to mental health is something I believe that can be avoided. And I would love to have more people on this program to discuss it. And I believe that we will do so, how we can face this problem. because nothing in life can happen. We can't get anything done if we are not there mentally. We talked about water. Water is important, yes. But you see your mental health, it is everything. So pay attention to the signs. And sometimes it's not the people who are lying down in the bedroom and just don't want to get up to take a shower. That's maybe just a mood. Always check on the ones that are the up and up, the ones that are smiling and being there for everybody. They are carrying a serious load. Please be there for them. Look out for your loved ones. Talk about mental health. See how best we can curb this problem and fix it. I'm Joanne Haigh. Face it and fix it. We'll be back on Monday. Have a great weekend. Getting it off. Please. People take up these letters and wait they give me an envelope to return something. I put it in this. Long.
Yeah.
Said you know I'm going to see handwritten. You really people's handwritten letters anyway?
Well, some people. Particular people.
Well, I guess the mass ad is working.
Yeah.
Hello.
Man, I come from Elsevier.
Yeah. She probably was writing with the show.
Okay.
She was saying it with mask. And she likes all it fits on my face full and all the protection. I was like, okay, well. Thank you so much. Thank you. I had a mask here somewhere. Where it is. Everybody have a good weekend. A safe one. This one here. Friday.